So welcome. This is Adam Gomez. He's going to be just kind of sharing who he is, what he does, and answering a couple of questions that we got for the DSM-5 specifically, and what mental illness, how it's determined for mental illness, but also at the same time, what it means to be chemically imbalanced when a doctor says that. So go ahead and introduce yourself, Adam. Who are you? What do you do? All of that fun stuff.
Sure. Hello, Denise. Thank you very much for having me. Really appreciate it. For those of you didn't hear, my name is Adam Gomez III. I am I am a recent graduate with my master's in marriage and family therapy at Pepperdine University, and I have known Nisha for way too long. It's been a good time, a lot of years there. And yeah, I'm very happy to be here. I really appreciate you inviting me to talk about the DSM-5 and to talk about any chemical imbalance questions anyone has, for sure.
Awesome. So as Adam said, we've known each other for a really long time. We go all the way back to freshman year of high school. So you said that you are a recent grad of being an MFT. Can you explain what that is to people? How is that different from the clinical side versus maybe the research side that I'm on?
Yeah, very good question. So MFT, marriage and family therapy, is more of the counseling, more of the therapy side. It's kind of like the job that you kind of see in like the media, like movies and TV shows. It's kind of the person that you come into, and we have like one-on-ones or group family sessions. In my field, being marriage and family, it kind of has a different population of couples or individuals, and it can go from all age ranges and all kind of society backgrounds too.
Awesome. What would be your advice to someone who is pursuing an MFT degree?
Ooh, that's a very good question. You'll learn very early on with handling clients, handling people in general. Have a lot of patience, definitely. You'll learn as you go through the program the term countertransference. What that means, countertransference, is kind of an ability to understand that certain issues or problems that maybe you're facing yourself, the therapist, you don't want to kind of transfer it over to the session, to the client. So that's a big thing that a lot of us kind of have to face and kind of have to keep in check. Also, to kind of get graduated from the program, to get like licensing, you have to be very good with like handling your paperwork, documenting like your hours and your progress notes. So have a very good computer, have a very good filing thing. So I just say stay up on top of that, and a lot of it's a lot easier than that. And have fun, you know, with your sessions and clients, for sure.
Love that. And then one of the other questions that I get a lot from just individuals about MFT degree. I used to be an academic advisor, so I'm sure you know, how many hours does it take to get the licensure to be an MFT individual, to hold that license?
So to get the different degrees, usually have different requirements. For MFT, in my program at Pepperdine, we had to have, I believe it was 270, I better know this, 275 documented hours during the program, and that's what gets you to graduate. I'm very lucky I was able to get that done finally. And then to get licensing to go further, once you're past the program, you still have to continue to document those hours. And to have it fully certified, I believe it's about 3,000 hours.
It's a lot of hours to do all of the stuff that you have to do to get to where you are. So this is the last question on the education side, and then we'll move into the deeper questions. What is one way that you stayed motivated to get those hours done? Are you still working on those hours? And what is just an encouragement you can give to other students going down that route?
Well, to stay motivated, I think, to be completely honest, I think I've always been kind of driven in this field. I think most people, not to generalize, but a good population, once they've kind of gone to the pursuit of the graduate degree, I think they kind of acknowledge like their passion is there, for the most part. It's not gonna like fizzle away. But I will say a big thing that I've learned is definitely self-care, definitely taking time for yourself. I had to do my practicum and my location, my centership and all that stuff during the pandemic. So it's very stressful. I imagine we all face some stressor, some kind of trauma during that time. So my advisors, my supervisor and everything definitely were very on me about taking time for myself, having time to kind of move away from the academic part for at least like a day in the month or a day in the week, you know, get the recharge buttons. It makes things a lot, because a lot of people burn out. So you don't want that to happen. Luckily, I am complete with my hours, so that's why I'm very happy with that.
Yes.
I will be officially graduated by next month, so I'm very happy with that. So that's really good.
That's huge. Congratulations. Yeah. A lot
so
of work.
So I just applied for the little piece of paper, which is good. And it's not as daunting as people think it is. It's very doable. Always think that.
So that's the advice, is that it is doable. So if someone is just kind of, if you could, with the hours that you've had to complete, how many hours would you say that you put in a week for those hours? Was it 40-hour weeks, or did you do it 15, 20 hours? How did that look when you did the school hour practicum that you had to do?
Very good question. Well, everybody's different. I know with my practicum site, once you get more than 5 hours a week, because you have 5 hours a week individually with you and a client, and then along with the practicum, you have a 2-hour session with a supervisor once a week. So once you pass 5 hours with clients, so if you have like a sixth client, now you're over 6 hours, you need to have 2 supervised sessions with your supervisor. Does that make sense? So, yeah. So as long as you have availability, I know everybody's different. My certain case, you know, I have a full-time job while I'm in full-time school. So I was able to always stay consistent with 5 hours. And the struggle with that is sometimes, you know, with your clients, they can call out, they can just not show up, they can move around their schedule. They have lives too, I understand. So always be prepared with that. But if you're fortunate to have a more flexible schedule and you can kind of add up a little bit more to, you know, maybe I have other coworkers who have like 8 to 10 clients per week, and they're very able to do that. And I think if you know yourself that you're able to kind of acknowledge that that's doable for you, I say more experience points for you. Yeah.
That's awesome. So let's go into the DSM-5 conversation. So yeah. I know what it is, but a lot of people actually don't. They just hear someone say, hey, DSM-5. We call this the Bible of psychology, specifically for your side. I know that is, I felt a little silly because I was like, hey, do you know about the DSM-5? And you're like, yeah, duh. I was like, well, that was probably a stupid question to ask. But what is it, and how do doctors use it to, I don't know if it would be to diagnose, or what is it and how is it used?
Very good question. So yeah, if you've never heard of the DSM-5, DSM-5 is an abbreviation. It stands for Diagnostic and Statistical Manual of Mental Disorders. The 5 is the 5th edition that it is. The 5th edition has been revised lastly in 2013. So that is kind of the last time it had like its update. A lot of people, since it's been 2013, people have asked, oh, is there going to be a DSM-6? As of right now, no one is really considering it. No one's really thought of it just yet. The first DSM was actually published in 1952. So it's definitely been a good amount of time. And they revise it because we come across new research details, new opportunities to kind of diagnosing people. To answer your full question though, what is the DSM-5? It's used as like descriptions and like symptoms and other kind of criteria to kind of diagnose mental disorders during like therapeutic sessions and like evaluations.
So when these diagnoses come in, who is it that gives that diagnosis for people who may not be aware?
Oh, okay. Well, the book is made by the American Psychiatric Association. So a lot of psychologists and therapists, even myself, during like my practicum that I just mentioned, we're kind of briefed into experiencing on kind of diagnosing our clients. It's not necessarily our diagnosing of the client is kind of going to go justifying to give them like medication and stuff, but we're getting kind of that familiarity, that kind of exercise, and kind of seeing the symptoms that we see. When you have like a client who may be a little bit more of extreme behaviors, maladaptive behavior, their symptoms are kind of a lot more elaborate, then we propose an evaluation with the psychiatric, and they kind of give a lot more details on like the possible signs of a disorder, and then you can go further with like medication or other kinds of treatment too.
I feel like this is something that's really hard for people to grasp, not because it's difficult, but because there's so many different things at play. You have your therapist, you can have a counselor, you could have a psychologist, a psychiatrist, a doctor. So in your field, would you as an MFT be able to just prescribe medication, or how would you go about to make sure that that individual is getting the right medication, and who would just prescribe that for them?
Very good question. So when I first meet a client, the very first session I do what we call an assessment. It's kind of like a big word for like a more intense interview process. So during the assessment, I ask a lot of easy questions, and I ask some uncomfortable questions. I ask kind of like the general, like date of birth, your cultural background, why are you here, things like that. And then I ask more intense questions, kind of like as far as like suicidal risk, ideations on like possibly self-harm, things like that. I also go, and part of the assessment when I bring it up is we talk a lot about medical history too. Are they currently on any kind of medication? Have they been on medication before? And then during that kind of first interview, I kind of have, I'm no expert yet, but I definitely have kind of a more eye to kind of see signs, see symptoms that the person is kind of showing, displaying. And from there, I can kind of make a suggestion, a recommendation. Like, I think this person is kind of demonstrating high anxiety or high depression or, things like that. And then from there, in my current state, I then take it to my supervisor and say, hey, I'm seeing a lot of this stuff. And then if my supervisor sees that and trusts me, then they might recommend a psyche evaluation. So that's like the next channel. And what that does is they basically do exactly what I did. They just do it a little bit more trained. And then if they see something that I saw, then they are the ones that kind of go, okay, I think this person might be, let's just, for example, might be explaining like bipolar. So let's put maybe a description on a medication of, lithium or whatever they feel could be working to just help the clients, feel, a little bit better.
That's a good point. So with that, a lot of, I've heard the term of chemically imbalanced, where a doctor might say this to you. What does that mean, and why does it sound so scary?
So it is a scary term. And me personally, it's scientifical. So, it's not necessarily the wrong phrasing, but as you just pointed out, people who might not know what that means or might be a little confused on the term, it could be daunting. It could really scare them, and they could immediately kind of withdraw from you. So I personally don't try to use that term so much. But education, I think, will help people, not be so scared about it. chemically imbalanced, what it comes down to is if you have like, substances in your brain, as far as maybe neurotransmitters or things like that, that kind of connects the brain together, it might have a little bit too little or too much of that operating the way that it usually should be kind of going with. And so if someone kind of sees that, then that's where kind of the medication side comes in. A lot of people, when they kind of have that, they usually get prescribed something called antidepressants. And that kind of, what that does is that kind of either regulates those imbalances and kind of gives those chemicals the extra energy or the kind of restraint that they need to kind of function.
So I do have some parents who have kids on, like, listen to this stuff. So
yeah. Oh no, I think you cut out. Uh-oh.
I muted myself.
Oh, you did? Okay.
I did. I have big thumbs. And so my thumb decided to touch the button, which is great because I think this is the best part about doing these things live without practice. So like I was saying, there are parents who have kids who might have a chemical imbalance or have heard that their kid has a chemical imbalance. And some kids, teenagers might be listening to this. So if you had to break down to a level of maybe 5th grade, how would you say, hey, this is what's going on in your brain if you were talking to a 5th grader?
So think of the brain as kind of like a mailman, okay? So it's kind of like you have a bunch of little mailman in like envelopes going back and forth through your brain, and they send messages back and forth through your brain. And everything's operating great, everything's going as it should go. But then let's just say something happens, which I should also say, no one necessarily knows the exact cause of why this imbalance happens. Mm-hmm. So there's not really something that they do. It's not something that someone else did to them. A lot of times it just happens like through growing up, aging, could be, genetics. It could be something that's, an event that happens. But anyway, so you have these messages just going through the brain all the time. And eventually what the chemical imbalance does is eventually those messages, those mailmen, what they're doing their job, they might start slowing down. They may not get the message all the way across to the other section of the brain as quickly. Vice versa, there's also cases where they might be working overtime and they might be sending messages going back and forth to where now you're trying to tell them like, hey, can you guys slow down? But they're not listening to you now. They're just constantly keep going. Mm-hmm. So what happens with that is a lot of symptoms that pop up during that time. It could be anything from like loss of appetite. You don't want to eat anymore. You want to sleep all day. You want to not sleep at all. It could be you're just constantly just irritable, which means like you're constantly just mad all the time. Anything little annoys you. You can have mood swings where you're happy one second and the next second you're just completely sad or mad for not really knowing why. You can have a lack of empathy. Oh no.
Hi.
Okay. Sorry. You big thumbs too. You can have lack of energy. You're drained all the time. You don't want to do anything. And also you can have lack of empathy. Empathy is like, the caring of another person or wanting that. You might not have that, adjustment as much anymore. And then when that happens, and parents might see it for their kids, or teenagers might see it around their peers again, like their friends, that's when like you're kind of noticing something is different now. And then that's when like we kind of come in to kind of notice that as well.
And that's why you recommend sometimes it's counseling, sometimes it's medication, sometimes it's both, and it's bringing the right things together and making sure like you are assessing them, but also your director or another person assesses to make sure you're not giving the wrong assessment, right?
Oh yeah, definitely. Okay. There's a lot of people that are available for you at all times. And then usually all those people have like different jobs for you. Like your school counselor will help you with school stuff. I might help you with like maybe some stuff that you just need to talk about. And then like the psychiatric side might help you with some kind of medication too as well. There's nothing that's more important than the other. There's nothing that's wrong with the other one. They're all there to kind of build you to get you where you want to be.
sounds really good. It's like a whole team for you. If somebody was experiencing any type of maybe anxiety, or they think they might be having anxiety or depression, where would you tell them to start first?
It's a very good question. So like with anxiety and like depression and things like that, those are mood disorders. Those affect like your mood and like how you rate. So I think the very first thing to understand is everybody has these feelings also. Everybody gets anxiety, everybody has depression. What makes it kind of go to that extreme as far as anxiety disorder is when it becomes a conflict in like your daily life. You know, you're unable to do certain things because the anxiety is kind of taking over certain things. The depression is kind of stopping you from doing certain things too. When something happens like that, one of the hardest things to do is to kind of seek help first. You know, a lot of people are kind of a lot of people might feel shame. They might feel embarrassment. They might feel like people aren't going to, they're going to say exactly what I just said, like, oh, everybody's sad. Don't worry about it. Everyone gets worried. Don't worry about it. You know, when that happens, a lot of people go, okay, it's just something that happens. And then it kind of stops there. Unfortunately, a lot also is that we learned in my programs, a lot of it could also be a culture thing too as well. You know, a lot of things like as far as culture have their cultural background to, oh, we don't really go into therapy. We don't really talk about our feelings, whatever that culture may be. The other thing might be, you know, resources too. You know, if someone is unfortunately in like a lower social economic state, they might not have the funds or the resources or the availability to kind of go out and kind of, you know, have those kind of opportunities, whether it be funding or whether it be just time. We don't really have the time to that. When that happens, though, I would say the biggest advice I would give is if you feel something is upsetting you, whether it be anxiety, depression, whatever it may be, you are not less of a person to kind of speak out for that, to kind of say, hey, you know, something doesn't feel all there and I don't like this feeling, so I'm going to talk about it. And if someone kind of gives you that kind of roadblock, go, okay, maybe you're not a person I can talk to. I know there is going to be someone that I can talk that will listen. And then eventually from there, you can get that resource, that therapy session, whatever it may be, the medication eventually maybe that can kind of get you to where you feel comfortable.
I like that. Last question is for those who might not be able to afford going to counseling or to even get the medication, are there resources that they can check out locally or by state or anything like that that you know of?
Yes. What I would recommend, you know, I think the easiest answer is, you know, there are always helplines. Those are always available for you on, you know, internet. If you search for them, they're very easy to pop up. Wherever you are locally, as far as where you live, there usually will be kind of a center around in some way that can kind of help you, even if it's like a Boys and Girls Club or something like that, that can kind of be there as kind of a, you know, resource. And if not, they can give you something else. I know myself personally, during my undergrad, I finally realized I had depression myself, and I did what you were not supposed to do. I didn't talk to anyone. I didn't look for anything, and I just let it sit. And that is not great, because when you're not dealing with it, you know, with extra help, it can manifest and it can grow, and you don't want that. So I think as far as anything, as far as even starting with the helplines, they can guide you into something else that can make you, you know, way better into, you know, helping you out.
We love that knowledge. I think helplines are such a gift that we often don't take advantage of because of, like you said earlier, shame and fear and sometimes even guilt of like, I shouldn't feel this way. But it was so great to have you on. It was so great to catch up with you shortly. But is there anything else you want to add before we close out?
I am very thankful for you having me on your show. If anyone was able to get something from this, I really appreciate it. That's what we do this for. If anyone would like to expand the conversation to anything else later, I'd be happy to come back, definitely. And just, you know, for all those people who might be struggling with anything, just know there are ways to always help you get, you know, more help.
Absolutely. And I'm sure you'll be back. I'm sure we're going to get some more questions. I know with mental health, it's always that thing of we're always learning, but we don't understand it. And I think COVID really exposed how much of us were living in just more of that anxiety and depression. I'm sure you've said it before already, where you said something about COVID is going to end up being in the next edition because it's going to COVID fatigue or Zoom fatigue or whatever comes from this, just because of how impactful and hurtful it's kind of hit us in the wrong areas. So thank you so much for joining. We'll have you back later. And if you guys have any questions, you guys can reach out to me and we'll bring Adam back to answer them. Thanks, Adam.
Of course.
Alrighty.